Hello everyone, welcome to Pikeville History Moments, where we talk about the history and heritage of Pikeville, Kentucky and the surrounding area. Today, we're continuing our series with part 2 on the 1918 flu pandemic and what it looked like in Pike County. Stick around to the end to learn about a local celebrity who survived the pandemic and went on to great accomplishments. As we discussed in part 1 of this series, we're recording these during the fall of 2020 and we're all experiencing the effects of the novel coronavirus or COVID-19 pandemic. In part 1, we talked about the impact the Spanish flu had on Pike County. We learned that about 1/3 of the global population were infected and at least 50 million people died during that pandemic. 675,000 of those dead were in the United States, and Pike County lost at least 293 men, women, and children to that disease in 1918 alone. We also talked about how similar the response had been in terms of social distancing, government restrictions, and mask wearing. In this video, we're going to talk about the differences. The first obvious difference between the two pandemics is how deadly the 1918 flu showed itself to be. COVID-19 has taken over 270,000 people in the United States so far and is still ongoing. It doesn't look like we're likely to reach the nearly 675,000 deaths that the Spanish flu produced. And in Pike County, while the deaths we've had so far are tragic, they are far less than the death toll from the Spanish flu. Of course, survivors of that flu generally had no long-term health issues, while COVID is so new that reports are still mixed as to whether breathing or other health problems may linger. Transportation is much better today, but the improvements within Pike County are truly amazing. Today, you can drive from Elkhorn City to Pikeville Medical Center in about 30 minutes. In 1918, that trip would likely have required an overnight stay. In the present, the ease of global travel almost certainly has contributed to the spread of COVID-19. While in 1918, the difficult travel likely slowed the arrival of the disease, but it also certainly hindered medical care. As of the recording of this video, typical treatments for COVID include antiviral drugs, steroids, and when necessary, putting patients into the intensive care unit or on a ventilator. And we shouldn't ignore the massive international search for a vaccine that's underway. Pharmaceutical companies from across the globe are using different techniques, including some based on genetics and involving RNA, in this effort. In the end, we hope to have multiple vaccines. Would it surprise you that none of those treatments were available in 1918? Antiviral drugs weren't developed until the 1960s, and the first approved use of steroids by the FDA was in 1950. Even antibiotics, which could have been useful in treating the accompanying pneumonia, weren't discovered until 1928. The polio epidemic in the early 1950s brought about the entire concept of an intensive care unit. And while ventilators began to be used in the late 1920s, it was also the polio epidemic that first prompted their use outside of the operating room. Vaccines have been around quite a while, of course, but the first flu vaccine was not developed until the 1930s. DNA itself wasn't discovered until the late 1950s, and the basic technique being used to pursue an RNA-based COVID vaccine has only been around about 20 years. Local healthcare has improved exponentially beyond the days of doctors riding out once a month on horseback. In 1918, there was no hospital in Pike County, as what would one day become Pikeville Medical Center would not open until December of 1924. Today, Pikeville Medical Center has over 3,000 employees, offers more than 400 different services, using the highest levels of technology available, and is a 340-bed facility, including 57 intensive care unit beds. And while Dr. W.J. Walters was the first public health officer in Pike County and was in that office in 1918, it was 1927 before a space was designated and the Pike County Health Department was formally established. Appalachian Regional Healthcare in South Williamson began as a United Mine Workers Association affiliated hospital established in 1956. Beyond that, the water system in Pikeville in 1918 only brought water to a spigot in the yard of the people living downtown, and most in the county carried water in from buckets from springs or hand-dug wells. Even in New York City, new construction wasn't required to have indoor plumbing until 1910. It's generally thought that it wasn't common in rural areas until the 1930s. So, it's unlikely that a single home in the county had proper indoor plumbing in 1918. Even simple hygienic practices like washing your hands would have been much more difficult. It makes you wonder just how much lower the death toll could have been had they had our technology in 1918. Or conversely, how much higher the death toll would be today if we only had what was available to them. Perhaps the biggest difference is just how much more isolated the people truly were back then. An article published by the Appalachian News Express earlier this year emphasizes that point. In it, Lake Hobson, a Mingo County, West Virginia resident who was nearing her 104th birthday, discussed her memories following the 1918 flu pandemic. She was only a toddler during the pandemic, but she remembers some of the consequences, such as the many times her family went into isolation during lesser disease outbreaks. She pointed out that isolation then was true isolation. It was just you and your immediate family and virtually no one else. Of course, today we have social media, for both good and ill, and video calling technologies like FaceTime. We have television with cable, satellite, and more streaming services than we can name. And the internet connects us to newspapers, books, and media from around the world. Some people attend church on Facebook or have business meetings or small reunions via Zoom. And did you know the first commercial radio broadcast didn't come along until 1920? What must it have been like then, even when you weren't in quarantine? Can you imagine seeing all that death around you and the only information you could get was the occasional newspaper and the stories your neighbor or that traveling doctor might tell you? And now a brief story about a survivor of the 1918 flu pandemic. In a recent Pikeville history moment, we gave a brief introduction to aviation pioneer John Paul Riddle. While a lot of locals recall the name, and some number of them know that he once flew an airplane beneath the old Middle Bridge, his name recognition is not what it once was. But make no mistake, at one time he was a celebrity, and by all accounts, he was a hard worker even at a young age. In 1918, he would have been 17 years old and attending Pikeville Collegiate Academy. But he reportedly decided to chip in to help a local doctor during the outbreak. He drove the doctor to house calls to visit the sick and ran various errands for him. Riddle came down with the flu himself, but pulled through after several weeks. You'll want to go back and watch our video on John Paul Riddle to find out how much the world could have lost had he not made it. Thank you for watching Pikeville History Moments. If you're watching this on YouTube, please hit like and subscribe, or click on the link to our website at visitpikeville.com. We have included links to a few of the referenced Appalachian News Express articles in the description below. We hope this episode helps reassure you that things will get better. We've come through a lot worse before. And more than that, we hope you all stay healthy and safe.